Hello there, everybody. Welcome back to 3 News Now. I'm Stephanie Haney. It's Monday, October 26th. I've got your top stories from WKYC.com and our WKYC app. I really appreciate you choosing to be here to get filled in on what is impacting you here in Northeast Ohio. We'll start today with those latest numbers in from the Ohio Department of Health related to COVID-19. And unfortunately, Ohio has reached another grim milestone in the ongoing dealings with the COVID-19 pandemic. We are now over 200,000 reported COVID-19 cases here in the state. Now, keep in mind that does date back to March 9th, but there have now been officially over 200,000 either confirmed or probable cases of COVID-19 here in the state of Ohio. And for the 7th day in a row, there have been over 2,000 new daily reported cases of COVID-19. Let's get into those exact numbers right now. Today, the Ohio Department of Health is reporting 2,116 new reported cases of COVID-19, bringing that total now to 200,231 total cases that have been reported here in the state of Ohio. Now, just on Saturday, there was the record here in Ohio of 2,858 new reported cases. This was after several days of record-setting numbers in a row. And the average positivity rating is now over the World Health Organization recommended threshold. The 7-day average here in Ohio for all COVID-19 tests being done is 5.5% of those coming back positive. That's up 0.2% from the weekend. There have been 11 new reported COVID-19 deaths in the last 24 hours, bringing that total to now 5,217, and 140 new hospitalizations in the last 24 hours. That's up from 89 on Sunday and also up from 140 on Saturday. There are now over 1,400 people who are currently hospitalized with COVID-19. That number continues to go up. It's 1,406 to be exact, with 408 of those people being treated in an intensive care unit. That's about 29% of the total COVID-19 active patients being treated in an ICU right now, with 37 new ICU admissions in the last 24 hours. The statewide hospital bed occupancy rate is now at about 68%, so 32% of our state's hospital beds remain available for people who do need inpatient treatment at a medical facility. Now, at the national and the global level, those numbers continue to go up. These numbers come from Johns Hopkins University. Across the U.S., there has now been a total of 8,661,917 reported COVID-19 cases and a total of 225,379 reported COVID-19 deaths. And as the global numbers continue to go up at alarming numbers, we are keeping pace with that here in the U.S. The U.S., with about 4% of the global population, has about 20% of the global cases of COVID-19 and about 19.5% of the global deaths related to COVID-19. Now remember, a week ago, I sat here and told you that the global number for COVID-19 cases had hit 40 million. Well, that number today is at 43,238,481. So over 3.2 million new global cases of COVID-19 in the last week. The total number of deaths globally in the last at this time right now is at 1,156,366. So now, as we just went over those numbers, we now know that COVID-19 deaths are rising again in the U.S., which is something that medical health professionals have warned about. Now, they are not as high as they were when that number peaked, but the cases are now higher than they were when that number peaked here in the U.S. The reason for the daily number of COVID-19 deaths in the U.S. was 794 on Sunday. So that's up 10% over the last 2 weeks, when we were looking at about 721 new COVID-19 deaths across the U.S. Now, the U.S. peak for deaths in the height of the pandemic was at 2,200 per day. That was in April. That was still back in the time frame when we were seeing a lot of COVID-19 activity in the state of New York, in New York City specifically. Confirmed infections per day are rising in 47 states, and deaths are up in 34 of those states. Now, health officials did warn that it was only a matter of time before deaths started turning up when we saw these surging numbers, record-breaking numbers of confirmed cases across the states. It was on Friday that the U.S. set a record for over 80,000 new reported cases in one day. That was according to Johns Hopkins University. And then again on Sunday, there were over 80,000 new reported cases, on Saturday, new reported cases of COVID-19. Now, here's the thing about this, though. It's tough to compare these numbers over the past 8 to 10 months for a few reasons. Testing has expanded dramatically, although the experts do say that this rise in COVID cases is not only because of a rise in testing, and here's why. The true number of infections is thought to be far higher because Americans have not been tested, for one, and studies suggest that people can be infected with COVID-19 without feeling sick, and these people are then potentially spreading that to other people because they are unaware that they have COVID-19. It was on Sunday that White House Chief of Staff Mark Meadows said that, quote, "We're not going to control the pandemic." He said the focus would be on containment and treatment. And President Donald Trump, who spent several days in the hospital being treated for COVID-19 himself, has said repeatedly over the weekend that the country is rounding the turn when it comes to the COVID-19 pandemic. Now, that's interesting language when we look at the fact that we just saw a record-breaking number of new cases in the U.S. and deaths are on the rise in 34 states across the U.S. Dr. Anthony Fauci, the nation's leading infectious disease expert, said over the weekend that it might be time to consider a national mask mandate. And he did bring up the fact that, yes, when you make something a mandate, you do have to enforce it. But he said with the numbers looking the way we are, if we don't do something here in the U.S., we will, in fact, be looking at a very grim winter in terms of those COVID-19 cases. And yes, eventually, those COVID-19 deaths, because it does take time for people to get sick. And if they are going to succumb to COVID-19, unfortunately, to pass away from the disease. And then we're also now learning that several close aides to Vice President Mike Pence have tested positive for COVID-19. The Vice President and the Second Lady Karen Pence, we know that they tested negative on Saturday, but we do also know from medical experts that it can be several days with an incubation period. So Vice President Mike Pence has been recommended to quarantine. However, he is not doing that, despite the fact that the president did reference that he was quarantined. He is not doing that. He has continued campaign travel. Now, as we talk about COVID-19 and taking care of ourselves, it is also important to remember that there are other things that we need to be concerned about when it comes to our health, and that's the focus of today's Mom Minute Monday. Taking care of yourself so that you can take care of your family, particularly directed at mothers, but also this particular segment makes sense for all women because the focus of this segment as we near the end of Breast Cancer Awareness Month is on mammograms. And 3 News' Maureen Kyle talked to Cleveland Clinic breast radiologist Dr. Laura Dean about this, who said it is very important that people make the time for these routine health screenings. Dr. Dean said that one thing medical professionals are worried about with COVID is, especially regarding breast cancer and other cancers and these health screenings, is that women might delay these really important screenings, including the mammogram screening, and that unfortunately might mean that breast cancer is being detected later and also at a higher stage when it becomes more difficult to treat. The doctor said that a lot of times she'll hear patients say that they don't come in for a mammogram screening because they don't feel anything in their self-exams. But the doctor wanted to make sure that people know that these mammogram screenings actually can detect things before you would be able to detect any sort of change in the breast tissue in a self-exam. And that is one of the main purposes of getting that screening, so that you can attack these things early, try to treat these things early before they become more advanced and more difficult to treat. The doctor said that it is safe to get your mammogram screenings and also your regular screenings right now, and stressed it's important because many people who are the head of a household, who have a partner, they will be tending to take care of other people before they take care of themselves. But if you don't take care of yourself, you won't be able to take care of other people. That was the message that the doctor was sending home. And she also said just some general tips to eat a balanced diet and also stay active. These, of course, are not things that are going to prevent cancer, but these are things that in general will keep your immune system well so that your body can fight off things. Some of the things that she recommended were eating the rainbow. That's referred to as eating a wide variety of colorful fruits and vegetables, healthy proteins, and limiting sugar intake. And also just getting active when you can, going out there, taking a walk. I know it is getting colder here in Northeast Ohio, so bundle up and get out there while you still can before it gets too bleak in these winter months here in Ohio. Now, speaking of the weather changing here in Ohio, Ohio is one of 18 states that requires your headlights on when your windshield wipers is on. So this is just a reminder for that as we head into the fall. We're going to see some more rain. We're going to see some more gray weather. So if your windshield wipers are on, your headlights need to be on here in Ohio. Easy reminder, wipers on, headlights on. If you have the automatic feature on your car, this might take care of it for you. Luckily, that's what I have. I haven't had to remember to turn on my windshield wipers or my headlights, not my windshield wipers, but my headlights in a very long time. So, and when it's raining, it tends to be darker out, but just make sure, just in case, if your wipers are on, your headlights need to be on here in Ohio. And as we move toward Election Day, which is coming up on November 3rd, many of you have already been voting. Early voting is up across the country. We're seeing record-breaking numbers of early voting. We want to see your I voted election sticker selfies, and we also want to hear your stories about why you're voting, about what motivates you, whether this is the first election you've ever voted in, whether you just turned 18 or you're 75 years old and this is your first time voting. If you voted in every single election, in every single primary, we want to know why and what your motivation is and what it means to you to have the right to vote here in the United States of America. So there are several ways that you can send this to us. You can use the Near Me feature on the WKYC app. Just open up the app and you'll see Near Me in the bottom right corner, and then you'll be guided through to submit that video to us, giving us your testimonial about what voting means to you, and also your I voted sticker selfie. You can also text photos to us at 216-344-3300, or you can post these things on the 3 News Facebook page in the comments for the story asking for your voter testimonials and also your I voted sticker selfies. And one last way, you can use hashtag 3election on social media. Then we'll see that. And we just might use your video or your photo on one of our TV shows or on WKYC.com or any of our social media platforms. One more reminder for you as well that 3 News Now with Stephanie Haney, that's me, is a podcast. You can find that on your favorite podcast provider platform. Just search for 3 News Now with Stephanie Haney. 3 News is one word and it is the number 3. And I would love it if you would subscribe, rate, and review the podcast so that we can connect with more Northeast Ohioans here. And also drop me a DM at _Stephanie Haney. Let me know what you're thinking about the show and what you would like to hear about. That's it for your 3 News Now afternoon update for Monday, October 26th. I will see you next on What's New at 5 p.m. in the Trending Stories segment called Clicking in Cleveland. And I'll see you back here tomorrow for more 3 News Now. Everyone stay safe and be well. I'm Stephanie Haney.